It's nice to meet you.
You too. I'm so excited to get to actually talk. So we will just get started with some questions and hear your story.
Yeah, yeah, sure, sure,
So
absolutely.
to start off, if you just want to tell us when you first noticed that you had hyperhidrosis, and is it something that you noticed, or did somebody else sort of point that out?
Yeah, the first kind of memory that I have was in probably the fifth grade, as like a young girl going through puberty. I think that just it starts, starts there. And I vividly remember signing yearbooks at the end of the school year, and all of the ink was just I was smudging everyone's note. I was so embarrassed. I'm like, what is going on? I couldn't, and that was the first instance where I'm thinking, something's not right here, and this is
Mhm.
I'm hoping this goes away, whatever this is. So probably at around 12 years old was when I first experienced the effects.
Wow. And is that the moment that you started looking into treatments, or how did you sort of handle that once you realized, like, why are my hands sweating like this?
That wasn't the moment I started researching. I think that was the moment I started doing anything I could to hide it.
Mm,
Anything I could do to completely mask it and pretend like it did not exist. So, it started with carrying a sweatshirt to class with me, every single day, and using it as, some kind of towel and anything to absorb the sweat. I'd carry around cold water bottles that were dripping with condensation so that it was an excuse if I ever had
yeah.
to touch anything. And I'm sure you're no stranger to
Oh,
some of these
yeah.
tricks. Yeah, yep.
Wow. So when did you first start seeking treatments after you're like, okay, I can't carry around a sweatshirt forever?
Right, right. It was definitely in, I would say, probably not until my high school years I really started researching, and bringing the concern to my parents. What is going on? Is this hereditary? I'm one of five girls. I have four sisters, and not one of my sisters has this issue, and I'm thinking, why me? So, my dad does have some clamminess in his hands, but nobody in my family had hyperhidrosis to the extent that I seemed to have it. Lucky me.
Right.
Um, but so I started to research, what are the treatment options? Does anyone else experience this? I felt very alone,
Yeah.
in this journey, and so I recognized, started making doctor appointments with dermatologists and understanding what some of the options were. And that's when it started with topical treatments, right? Different deodorants and just creams and just any sort of topical treatment to kind of hinder that sweating, because I have hyperhidrosis, or did, of the hands and feet, so palmar and plantar. So it was always my hands and feet that were sweating, and the topical treatments worked a little bit. It wasn't a cure by any means, but
Right.
it did suppress some of it. But the effects were terrible. I had tried dry sol, and my hands would start cracking and bleeding, and it was just very aggressive, and it was challenging to find that balance. So then I tried, wipes, then I went to oral medication, and that resulted in a lot of dry mouth. I couldn't even speak at some points because I ended up taking so much of the prescription.
Right.
And that's when I, found the surgery, the endoscopic thoracic sympathectomy. I was in high school and had to do a senior project, and I decided to dive in and really research what hyperhidrosis was, what were the treatment options, who
Mhm.
else is suffering like I am. So I had penned a small article and presented this as a project, and that's really kind of the genesis of my research, was through a school project.
Wow. Thank you, school. Sometimes it comes in handy.
Exactly. And sorry for the long-winded response. I'm
No,
just
I love it. That's perfect.
rambling.
Good to hear. So that's awesome. So how did hyperhidrosis affect sort of those relationships growing up, whether it was friends or dating with family?
Oh, all of the above. All of the above. I mean, think about how much you use your hands in a given day. So it was affecting relationships just from when you're a young girl and you're creating friendship handshakes, and or people are holding hands, or you have to do team exercises and oh, everyone hold your, hold the hand next to you. It's like, oh, those dreaded words.
Yeah.
I never wanted to hold anyone's hand. And then that, as I got older, was challenging. I'm thinking I'm never going to have a boyfriend or a partner in life because I have this terrible condition. So it really did. And it's hard for other people who don't have this condition to understand just how much it impacts you on a daily basis. Even when I started learning to drive, right, I was holding the steering wheel and my hands are just dripping with sweat. That's
Mhm.
dangerous, to an extent. I had to get a cover for the
Yep.
steering wheel on my car just to absorb it, right? So yeah, it has affected every relationship. Thankfully, I have wonderful people in my life who never made me feel like it impacted anything. It was, but for me, of course, it's an insecurity.
Yeah, and I think that's how it is a lot of times with the people that have hyperhidrosis. It bothers us more than it bothers the people around us. That's something I've picked up from talking with a lot of patients. I always heard like, it doesn't matter. Like, I don't care that your hands are sweating, but I know it bothered me. I was like, this isn't about you. This bothers
Right.
me. Just
Exactly.
it's an uncomfortable feeling, and it doesn't matter how many times somebody says, like, "It's fine, it doesn't matter." It does, like, it's just one of those things that, like you said, you will never understand it unless you went through it.
Yep, exactly. Exactly. And I'm grateful that everything I'm saying, and you're nodding your head like, yes, someone else
Yeah.
gets it. And you've been through that struggle, because you find every trick in the book, you find every excuse, and even the people who you love who you tell you it's okay. It's like, but it's not, because you don't understand every single day how, every piece of technology. I was breaking technology because it was so aggressive. So you just don't realize how fortunate you are to have dry hands.
Yeah, it really is the little things, and after surgery, I don't know if you can relate to this, I made a list of things I was excited to do after surgery, but there have been more things than I can count, just, like, that I didn't even think of because I've had this my whole life. So it's, like, the tiniest moments, and I still, to this day, a year past surgery, I'll be like, "Oh my gosh, that would not be the same if my hands were sweating right now."
Right. And you have I have like these weird phantom feelings where I'm like, oh, maybe, oh, are they gonna start sweating again? And then they don't. And it's like,
Yeah. It is so bizarre. That will go down, but it still happens once in a while, like situational phantom sweats, I
Mhm.
guess. Whereas right after surgery, it would be like pretty regular. Like every time somebody went to shake my hand, I'd be like, "Oh my gosh, my hands are what am I gonna tell them?" Like I would still think the same thing. And I'm like, "Bree, calm down. You are
You
fine."
don't need to worry about that anymore. It's like,
It's
you're
wild.
you're not wired to think that way, but
It is bizarre. So obviously it affects relationships, but can you tell us if it affected you academically or maybe like career-wise, if you chose a different career path because of it?
yeah, absolutely. I honestly tried to stay a little bit more behind the scenes in my work. I'm a working professional woman, and I love to engage with, partners and customers, but shaking hands with people. I mean, this is pre-COVID, right? Of course.
Right.
Um, and so, COVID was kind of a blessing for anyone with
That's what
hyperhidrosis. You're like, don't touch me. Fist bump.
yeah.
So but yeah, in terms of, academics, even when in elementary, high school, anything, any paper you're writing and taking any sort of quiz, your SATs, you're trying not to shrivel the paper that's underneath your hand. And then and just from a professional standpoint, yeah, I did not want to be in a forward facing role, shaking hands with people and engaging in that way, because I just didn't want to have to make an excuse as to why my hands were sweaty. So the surgery really inspired me to take on new experiences and initiatives in life, personally and professionally, because I have this freedom now to engage with people in that way. Just high fives and handshakes.
Yes, it really is little things. I remember for like as soon as I could start working, I wanted to work. I've always wanted to work with people and like be there and be active, but one of my careers that I did from like 15 all the way up until like 20 years old was I was a nanny and a dog sitter. So I was constantly meeting new families. And the first time you meet people, they want to shake your hand. So I would walk in there with like an agenda and a coffee, like looking like this little professional 15-year-old. And I'm like, hi, just a little shrug. And it got
Just anything to keep your hands occupied.
exactly. It worked every time. But man, like now after surgery, I'm the first to go in for a handshake every time. I'm like,
Yes.
nice to meet you. I can shake.
Ah, look at you. Touch my hand. It's
Exactly.
funny you say that about nannying actually too, because that just triggered something. I also nannied for a while growing up, and I remember actually holding it, an infant, and I felt so terrible because this poor baby's back is like drenched in my hand sweat from me holding them. And I'm thinking, oh my gosh, this is the rest of my life now? My own children, I'm not going to be able to like hold my own babies because they're just going to be drenched in my hand sweat. It really does mess with you in that way and
Yeah.
impact you on levels that other people wouldn't understand. So it really is an incredible treatment. The
And it's
surgery.
so funny, like, we all have sort of the same stories. Everybody with hyperhidrosis, they all intertwine. Like, that moment, it's on my list of 10 things because I'm an only child, but I think that's why I love babies so much, and thankfully, I have a lot of baby cousins, and I remember one time so vividly, I was at my uncle's house, and I was holding my little baby cousin, and I went to hand her back to her mom, and the mom was like, "Oh, she must be hot. Her back is so sweaty." I was like, yeah, she was like a little heat box. I don't know.
And you're just mortified, like, oh.
Yeah, it's like, oh my gosh, it's so embarrassing.
Yep,
It's the only
yep.
one I knew, but like the feeling that I had was like, I'm so over it. And that was
Mhm.
like one of many things that led up to me getting surgery. But I have one moment that was like my breaking point. Do you have a breaking point moment where you were like, I'm over it, I'm doing surgery, or did it just sort of build up?
It built up so much over time. I had looked into surgery, but not serious enough to take that leap. And I was just in a phase of life where I was moving into a new job. And again, it was one of those things where I'm going to be meeting all these people in person. I'm going to need to be shaking hands. This role is going to require me to engage with my hands in a way that I don't want to, and I need a solution because I had held out hope that I wouldn't need surgery, right? I was like, there has to be something in the market that will work, that won't require me to undergo surgery, and there just wasn't. I tried everything, and that was kind of the pitch to my parents too, who were a little skeptical about surgery. I had to get them on board too. Um, to be comfortable with it. And so I think it was just years and years of pent up and really trying everything I could. And it just was the right option. It was. And I'm kicking myself I didn't do it sooner, to be
Oh,
honest.
no, that's what everybody says, and it's like, everything happens for a reason, and it's gonna come when it comes, but the fact that it's even out there, I had no idea that surgery was even an option, like,
Mhm.
literally no idea. I had tried all the different lotions, and then I tried iontophoresis, and when that didn't work, my brain just, like, shut off. I was done. I just got really, really good at hiding it. Even the people that knew my hands sweat, they did not know how bad they sweat. Like, my tagline was, "My hands are just a little sweaty." I'm
Yep.
sorry.
Yep. Oh, it's not nerves. They just sweat sometimes.
Yeah, it was just wild. So, can you walk us through your surgery process from, let's start at like your first phone call with Dr. Basseri and then through after surgery?
Yeah. Oh my gosh. It was a dream. The whole experience. Just I called first it started with a lot of online research, right? Who are the top surgeons that can perform this?
Right.
Do they have a track record of a positive history? And what are the complications, assessing all of the risks and who the right which treatment facility was the right one. And that's, the more that I researched and read, it was Dr. Basseri and the Center for Hyperhidrosis. So I gave him a call, spoke to him about the effects, the treatment options that I had already tried, including ontophoresis, which I was so hopeful for, and for me too, did not work. So and yeah, and he just was very transparent about the procedure. And it seemed a lot more actually feasible and simple than maybe I thought that it was going to be. So that was a big relief. And yeah, we scheduled we scheduled the consultation. I went out to meet with him a couple days prior to the surgery. You know, the facility had given me all the prep work, you know, to prepare
Right.
for the surgery, and it was a very simple process. I was really grateful for that because it's a big decision and it's a life-changing one in a really good positive way. But I hadn't undergone surgery for anything in my life, so this was really a first for me. And as soon as I got there, it just, yeah, the level of professionalism, you know, from start to finish was just fantastic. So yeah, I vividly remember, you know, every step and interaction with the nurses, and having that exciting anticipation built up, like, this is really happening, it's really happening, I'm gonna wake up and I'm gonna have dry hands, this is insane. And that's exactly what happened, right? I think the most challenging part of it always is recovery. There were a couple days of recovery where you don't feel like your best self, but you are just, I remember being so elated, like, I don't care how anything else feels right now, I have dry hands.
Right. It really is like an overpowering feeling because for me, after surgery, like you do have that chest pressure, which the nurses prepare you for. They tell you you're gonna have it. They told me they're like, it's gonna feel like bricks on your chest, like a heavy pressure for just a
Mhm.
few days, and then you'll be good. And you know, it's either like the tightness or the pressure. For me, I noticed it more so if I was up walking around or if I was taking a deep breath. Is
Yeah.
that sort of the same for you or
Absolutely. Yeah, it was, and it's funny you even brought that up because it didn't last very long enough for me to really remember it being so terrible. You know, it was just a couple days of, like you said, that uncomfortable pressure. You know, but your body's recovering and adjusting to what it just went through. And yeah, so that was pretty minimal. And then minimal scarring too,
yeah?
which was you know, a relief as well.
Yeah, absolutely. I tell people all the time, like, the scars are so tiny. The
Yeah.
ones under the breast for me, being a year out now, completely gone. Like, I can't
Yep.
even see them anymore. And then the underarm ones, they're there, but it's like the tiniest little scar. Whenever I show people in person, I have to like point at it and they have to get right up close next to me.
Yeah.
Like it's right there and you see it's so
Exactly.
it still blows my mind, like, it truly blows my mind that, okay, I have a couple of tiny incisions, tiny little scars, and my hands are completely dry, like, it does not make sense to me.
I know. I know. And you're like, I tortured myself for years trying everything else, and like,
Yeah.
and this in one day, in one procedure.
Yeah, like, the way I explain it is 1 minute you're talking to the nurses, and the next minute you wake up with dry hands because you're under anesthesia. So, like,
You wake up and they're like, hey, it's time to go. And you're like,
you're
oh
like,
my gosh.
"I cried when I woke up." What was your reaction? Did you cry?
Oh, oh yeah. Oh yeah. And and I think I was just in shock and excited. And also I felt a little bit of, I don't even know how to explain it, but like, I maybe this isn't real. Nothing else has worked. And I think this is too good to be true. So I had a little bit of a, this is maybe too good to be true
Mhm.
moment. And it wasn't really until actually after, you know, days had passed, weeks had passed, and I was waking up every day and there was still no sweat, still no sweat. So I woke up so excited, but really cautiously optimistic.
Right.
Just because I had been burned so many times by other, you know, by other treatment options. And once, I think it was once a couple weeks passed, I was just every day like, waking up with a smile on my face. And I still do. I make my family members, friends, I'm like, here, will you hold my hand?
It's just the most amazing feeling, and, um, I told you about my list. Did you have certain things that you were looking forward to, with life with dry hands?
E- Everything, even from I don't know. No, I used to, I would wear gloves, like even chopping up foods, because I didn't want my sweat to like contaminate, you know, the food, and not having to like wear gloves for certain things, not having to carry around, you know, these protective barriers, not having to make excuses, yeah, holding hands, high fives, handshakes, even, picking up a guitar for fun and being like, hey, if I wanted to learn how to play this, I could, because so, and I'm no guitar player, but it's just having the option and so many possibilities really has just been such a joy. So I'm learning new things, every day that I like to do, that I know I can take advantage of now, because I don't have sweat to worry about.
Right. And it looks like your nails are done.
That's hilarious that you say that, because I'm sure you had this issue too.
Yes.
Getting your nails done was the death of me. And I always had to ask them can you please point that little fan like, towards me? I said, oh, they just sweat sometimes. And any time I was getting my nails done, it was, you get the looks, you get
Not
the
enjoyable.
questions, and how do you explain it?
Yeah. It was
And
always
especially sometimes when there's a language barrier, how do I don't
right.
know.
Well, and that just all wraps into like there is such a stigma around sweaty hands, whether it's in the professional world or even just something that should be as simple and enjoyable as getting your nails done. Like there's a constant stigma, and it's, oh, they're nervous, they're not confident, they have anxiety, they're this, they're that. When in
Mhm.
reality, it's an overactive nerve that we can't control. So it's like
Exactly.
I was probably like such a calm person. I know I was, but my hands made me seem like a totally different person. And then I would like freak myself out and get myself all like riled up because my hands are sweating and my mind is like racing. What am I going to say? What am I going to do if somebody shakes my hand? What am I going to do? Instead of just like being present. And I honestly, like, overall, my favorite thing now is just truly being able to be present in
Yes.
situations. And that's something I didn't even think about, because if you would have asked me if I'm present in situations, I would have said, "Of course I am." Like I always like I'm there, I'm in the moment, but I really wasn't. Like my mind was constantly thinking about my hands.
I love that you said that, because I can completely empathize with that. You don't realize, it has an impact on you, but we were conditioned to live with it. And that was part of our everyday. Now that we don't have to, it's like, oh my gosh, one less stress, one less thing to have to overanalyze or justify, or, but personally, professionally, it does give you this total weight off your shoulders. Absolutely. Yeah.
Yeah, and I felt that feeling like right away. My first memory waking up was the nurse Shoshi, and I literally, my mom actually caught it on video, and it's like the first moment I remember. I was looking at my hands, and I just hear her voice say, "Isn't that amazing?" And I like literally, it's the most unexplainable feeling. I felt like all of this weight just lifted off of me, and my first thought was like, "It's over," because when I had sweaty hands and they were dry, if I thought for a second, wow, my hands are dry right now, sweat.
It was like a cue. If you were in a position of, a level of comfort, it was like, oh, bye-bye. Here
Yeah.
comes the sweat.
And like, why did I think of it? They were dry.
Yep. You do everything you can to, oh, cold weather was the best. The winter time really was the best. Being outside. Of course. 'Cause you're like, oh, the cold air is keeping everything dry. Oh man.
It's so
Yep.
amazing. So amazing. So, if you had to just tell those that are still struggling with hyperhidrosis one thing, sort of to leave them off with as they're still waking up with sweaty hands, what would you say?
I would tell them, one, they are certainly not alone. There are other people every single day, men, women struggling with this, and there is an option, depending on your level of comfort, and ability, to invest in this surgery. I highly recommend you research the Center for Hyperhidrosis, as a treatment option for you, because it will change your life. I have recommended the surgery to countless people, and it's funny, the more I've opened up about it, the more I realize how many other people in my life actually struggle with it as well, who I had no idea, and they're also keeping it, close to the vest, because it is completely embarrassing and it's not something you want to draw attention to at all. But yeah, anyone struggling with it, I absolutely recommend that they research the Center for Hyperhidrosis, because there are options out there to gain, give you your confidence back and allow you to, do what you want to do without any sort of limitations or hesitations because of your condition.
Absolutely. My favorite thing is like I truly feel like I started a new life. Like, and looking back, I don't know if you have pictures of when your hands were sweating, but
Oh,
my mom and I will be at dinner and we'll just like pull up my pictures of my hands sweating and we're like, that's crazy. Look at that. Like, and I went through it. That's all I ever knew. I've only known 1 year of life with dry hands. The rest of it
yeah.
was sweating. But it feels like unreal. I'm like, how did I do that?
It is a new life. It's like it's such an exciting thing to know, forever. This is, there's no going back to those old ways, those old insecure ways. And it's funny, something you said earlier about, there being a stigma. I think, that I've encountered actually a lot of men in my life who also have very sweaty hands, but I find that there is even a kind of a different stigma between men and women. It's okay for men to sweat excessively, they're men, they
Yeah.
sweat and that's fine. Not for, but not for women, but I'm finding that a lot of men are also struggling with this, and it's still even a huge insecurity for them. So I say, male, female, whoever you are, everyone's struggling with it. And there are options out there, and you're going to
Right.
be so grateful.
Yeah, and it really does affect everyone differently. And like in my role, like that's one thing I'm so grateful for getting to talk to so many different patients from all around the world, in the US and outside of the US, and all different ages, men and women. And we all sort of share like the same baseline, but then there's certain little things that come off of that like for me, hyperhidrosis affected like my dating and like relationships like that more than anything. Whereas some people it affected them more so in their career choice or academically. And so there's
Mhm.
no like one size fits all, even just with the sweating. Like some people it's just hands and feet. For some people it's hands, feet, and underarms. Some have it in their face and their hands and feet. Like even that is so different. It's crazy. And the lack of education around the condition will continue to blow my mind. And that's why
Yep.
we do this. That's why like just two normal people sharing their story and putting it out there, it's gonna hopefully help even just one other person feel comfortable and feel that they're not alone because they're not. There's so many people that are struggling with it, and I never knew that.
Yep, absolutely. I had no idea that this affected as many people as it really does. And I'm grateful that there are people like Dr. Basseri and the Center for Hyperhidrosis and you, and who are bringing more awareness and education to this, because it is so important, to continue to educate just, not the public, but just people who are suffering and don't know that there are options out there.
Right.
Doesn't have to be a lifelong struggle. It really
No,
doesn't.
it just
But it's so debilitating, and it really mentally, is draining, to deal with this. So it was a life-changing surgery for sure. And I think everyone who has had it, can attest to that.
absolutely. And then one last thing that I'm just curious about, because this is also different patient to patient, but did your feet improve? How much did they improve, if so, or if not, are you considering getting ELS?
Interesting question. Because I was so happy because right after surgery, my feet stopped sweating too, and Dr. Basseri was like, "It's gonna stop, but just know that it's gonna come back." I'm like, "Well, I'll relish in those couple of weeks that I also have dry feet."
Right.
Um, so it didn't necessarily affect, how frequently my feet were sweating, because the sweating did come back, and now they're kind of sweating as they normally did. I
Okay.
care a little bit less about that because my hands are dry. Um, but I am absolutely considering the surgery, the ELS surgery. I'm just not privy to the compensatory, hyperhidrosis, the effects of having the surgery for the hands and for the feet. Is my back or my stomach or my armpits going to start, pouring sweat? I need to understand that a little bit more
Right, and
before,
get some more research.
before I jump in, but it's definitely something I'm exploring.
Yeah, absolutely. I was one of the lucky ones. I did not go into that surgery thinking. I was like, it was obviously in the back of my head that there was a chance. And then, you do have those couple of weeks of dry feet. And mine improved like probably 80, 90% or more. Um, and they really only sweat when they get hot. Once in a while, they'll get to like the same sweating level. Like they'll still be like really sweaty, but only when they're hot. So it's more manageable, but it's just so different person to person. It's interesting
Yeah,
how it works. And the option or the fact that there is an option to get your feet done. But like you said, like just having dry hands, life changing. Make the feet.
completely.
And then
Yep. I'm like, I've ruined so many pairs of shoes already throughout my life. Like I'm used to it. I cannot invest in like, I invest in certain kinds of shoes, not ones that I'm going to be super upset about ruining. So yeah, you get the struggle. And I'm happy to hear that it does positively affect people who are struggling with feet. For me, it didn't. But I'm excited to explore the opportunity to
yeah,
have that taken care of too.
absolutely. And then actually one final question.
Yeah.
For the compensatory sweating, can you just talk a little bit about that? That is like the number one question because there's so much information on it online, but a lot of it is when the surgery is the cutting or the burning of the nerve, and it's obviously very different when the nerve's clamped at the appropriate level. So if you can just share your experience with that.
Yeah, absolutely. I was pleasantly surprised by, you know, the effects post-surgery. I did experience a little bit of sweating on my back, more than usual, but really only when I'm exercising. And I've always experienced a little bit of sweating like behind my thighs. That hasn't really changed at all. So I would say, the only other effects after surgery was a little extra sweating on my back when I'm exercising or when it's hot,
Yep.
which I'm living in the desert of Arizona, so it's usually a little bit hot. But no, pleasantly was surprised by the lack of detrimental effects. There weren't any. If there's anything else I can do for you, let me know, but we'll be in touch.
Perfect. Thank you so much.
Awesome. Bye-bye.